In this video, we'll discuss about hypoproteinemia, causes and diagnosis. What is hypoproteinemia? Hypo means low, protein means protein, anemia means blood. So low protein content in blood, it is known as hypoproteinemia, low protein content in blood. How protein come to blood? We are taking protein diet. Protein diet reach to stomach. Digestion occur. These food containing protein containing food break down into amino acid. Amino acid are absorbed by vein. Amino acid are absorbed by veins. The veins take amino acid to the liver. Inside liver, protein synthesis takes place. Here, protein synthesis takes place. After synthesis occur, that protein go to IVC, interior vena cava. They reach heart. Okay, from heart they circulate. From heart they circulate different organs, different part of that body. This is how protein come to blood. Let's understand which step hamper. Okay, which step hamper, so body get less amount of proteins, less amount of protein in diet. We will take less amount of protein in diet, decrease intake of protein, which may leads to decrease amino acid and decreased production of protein. They there can be degrees observation here. Here there can be degrees absorption of protein, then degrees synthesis of protein. Otherwise here our liver will synthesis, this one will decrease. Or sudden pathological condition, the protein are excreted in kidney. Protein a huge amount excreted through kidney. In case of diarrhea or some pathological condition, lot of protein takes place in the diet, which is lost through gastrointestinal tract, which increasing loss of protein. So mechanism which leads to decreased production. These are the overview of hypoproteinemia. Next, the causes of hypoproteinemia are classified into three broad categories. First one is decreased intake, second one is decreased production, third one is increases loss. First one is increased intake. Low protein in diet, which leads to protein energy malnutrition. The protein energy malnutrition are two types, kwashiorkor and marasmus. What is this kwashiorkor? What happened in kwashiorkor? Low protein content in diet. In case of marasmus, protein, fat and carbohydrate. This will be causes hyperproteinemia. And condition is decreased production. How it can occur? Main site of protein production is liver. This one in case of chronic liver disease. In case of chronic liver disease, we have decreased production, or it can be liver cirrhosis. We have decreased production of protein that can leads to hyperproteinemia. Finally, increasing loss. Increasing loss, we can the increased loss takes place. Loss can be either renal route or loss via GIT. Renal route, that is loss of protein in urine. GIT, that is loss of protein via through GIT. How gastrointestinal tract loss takes place? Suppose the person having malabsorption syndrome, that can leads to loss of protein. Whatever protein we are eating, the protein is not getting breakdown into amino acid, but the amino acid not getting absorbed in GIT. It can be diarrhea. What can be diarrhea happen? What happen in diarrhea? um, in diarrhea the gut become highly mobile, so the mobility of gut so much. They transit of food they transit of food that you eat too much. The gut have less time to absorb nutrient. How ineffective absorption of nutrient increase loss, it causes hypoproteinemia. How in renal route, sudden condition of kidney nephrotic syndrome in which protein urea through kidney. Why this happened? Due to sudden problem nephron in the kidney. Huge amount of protein is filtered to the kidney. Is lost through urine. That situation we have loss of protein through renal route, which causes proteinemia condition. How to diagnosis? Any diagnosis started two basic steps: history taking and a clinical examination. History, um, we can check the diet of that patient. Then alcoholic intake means it causes finding of liver cirrhosis. Then history of bowel, diarrhea, dysentery in that patient. In the case of clinical examination, most significant way edema. Over here that edema, feeding kind of edema. Fluid escape blood vessels and deposited into tissue. In the case of transudate type of edema. So edema is transudate in nature. Then confirmation diagnosis for biochemical investigation. Very beginning we have to perform serum total protein test, will establish that patient have low protein in blood. Another test, serum albumin test along with albumin globulin ratio, AG ratio. This investigation will give more insight about etiology of hypoproteinemia. In this video discussed hypoproteinemia causes. Hypoproteinemia means low protein content in blood because of diet. Because of diet or decreased absorption of protein or decreased synthesis of liver or sudden pathological condition increasing excretion. Then renal road because of nephrotic syndrome. Diagnosis, two things: history and clinical examination. Finally biochemical finding. Thanks for watching.